anti-C1q antibody. Anti-C1q antibody as a novel biomarkers has drawn more and more interest in expecting its high specificity for diagnosis SLE patients and monitor the disease activity of SLE patients, especially the ones with renal involvement. The most recent study is 2017. Is 2017 was conducted by Carbido's Cis et al., who researched anti-C1q antibody as a better biomarker in SLE patients with renal and cutaneous involvement. They aim at locating the correlation between anti-C1q antibody, also other biomarkers of anti-nucleosome antibody and anti-dsDNA antibody as a clinical manifestation of SLE patients. Carbido et al. Carried out their research by using laboratory records of SLE patients who attended outpatient and inpatient services of using anti-C1q to test for from March 2013 to January 2015 in Asia, India. Anti-C1q antibody assay test with blood sample collected during the service of their disease symptom and conducted by ELISA kit, which is from Germany. The statistic data was collected and described in the following table. This table shows anti-C1q antibody, anti-nucleosome antibody, as well as anti-DS antibody has high specificity. Methods. This study will be conducted in multi-centered and cross-section setting to evaluate the significance of anti-C1q antibody in diagnosis SLE disease and monitoring SLE activity, and to compare with the other biomarkers of anti-nucleosome antibody assay and anti-dsDNA antibody assay. The evaluation of anti-C1q antibody, anti-nucleosome antibody, anti-DS antibody in different settings to determine if anti-C1q antibody can be a good biomarker, and if so, can it be used alone or combined with the other two biomarkers as new test panel with higher sensitivity and specificity. According to Systematic Lupus International Collaborative Clinic SLICC classification, 140 patients will be selected from 14 clinical facilities, in which 70 chosen as a 4 out of 1 by SLIC as SLE patients, and 70 SLE, and the others will obtain the series sample from the recruiting patients. They are normal people without any condition. Autoantibodies against C1q will be tested using the purified C1q or collagen portion as together with the enzyme-linked immunosorbent assay ELISA to prevent non-specific interaction. ELISA will be performed to test auto-nucleosome antibody and anti-dsDNA antibody. Conclusion: this study originated from the meta-analysis of current promising biomarker, will bring a new phase to display anti-C1q as a novel yet more efficient diagnosis tool for SLE patients, especially the great performance in monitor SLE activity with renal involvement. Together with anti-nucleosome anti-DS antibody as a new test panel with a higher sensitivity and specificity in the SLE diagnosis world. Thank you for watching.